Okay, no, I don't vote on the budget, anything. Oh.
Morning.
No, I don't want this next to you.
September 23rd, 2025 meeting of the Human Services Committee to order. Start with the approval of the minutes. Prior. Supervisor Running, Supervisor Strainer, on the second. Any questions, comments? Seeing none, all in favor?
Aye.
Aye.
Thank you. There was the floor, public comment, are there any members of the public or anyone else who wishes to comment? If not, we'll proceed. What are we starting here? Veteran Services or,
Yes, yes, sir.
okay. Please proceed.
Absolutely. So we are, first topic of discussion is going to be the 2025 budget review. I'm hoping that you all were able to take a look at that. There are no severe changes to the budget. In the comments section on page 2 of the actual worksheet, I did list anything that was there that needed comment with regards to contracts that we hold or information of why something might have been increased in a budget line item. And if there's any questions, there really is my budget is pretty self-explanatory. It doesn't have a lot of
Right.
intricacies to it like public health did. So
Any questions, comments from anyone?
I'm gonna move on if there's no comments or anything. Moving on to the actual accomplishments for 2025. At this point, Cindy Harris, who has been working for the Warren County Veterans Services Department since 2014, I believe, has been promoted into the Veterans Benefits Counselor position. Which is not unknown to her. She's been developing claims since I believe 2017. So it was truly I was pleased to be able to, being able to offer her to be promoted into that position.
Good.
She is a great asset to the department. My right-hand man. So if things get crazy, she definitely could pick up, where left off. So, and then we also welcomed in Janet April in June to backfill the position which Cindy was holding, which was the office specialist position at the front desk. So at this current time, we are fully staffed with an office specialist, 2 VSOs or veterans benefits advisors, Cindy and myself, 4 drivers, 3 dedicated to the Albany runs to and from the VA hospital, and 1 that does the local runs, which is joint with Office of the Aging. One thing for another accomplishment in 2025 is, and we'll go through the numbers on subsequent pages here, but we, for the first time ever, reached over 1 million in awarded claims. Now, backstory, this would have been when Jeff was in play, Jeff Cook, who left our employment in October of last year. So assuming, so Cindy was doing her own claims, Jeff was there, I was doing my own claims. Now the benefits of those claims are now just coming in and being awarded by the VA. And I will show you where we have just crested over 1 million for those claims. And again, it's a first time for my department. The OFA Veterans Services Local Transportation for Seniors and Veterans was started in January of 2024. this year we've transported 87 passengers from 9 different towns during 41 trips, and that's up through September. I'm sorry?
No?
Oh, okay. And then moving on, so some goals for 2026 coming up. I would like to, we have more than enough room. We're just trying to condense some files within our office, but it's something I've been thinking about for a couple of years now. With regards to outreach, we do get requests sometimes for veterans to be able to conduct either mental health treatment via telehealth, or go to a VBA board hearing. We don't have a dedicated space for that right now. What would need to happen is either Cindy or I would have to give up our offices in order for that person to have a secured location, so that they could talk with either a judge or a mental health provider or whatever it may be. So we're looking to reallocate a portion of our file area to a resource room. That would be able to supply this type of and conduct these type of online telehealth or hearings. It would also give dedicated space to, we have a lot of outreach workers that come to us looking for space for homeless veterans. They need to meet with a homeless veteran instead of meeting like at McDonald's, where they could be a little bit more private and talk about the, you know, where the areas in which they need the most help in besides housing. And it, you know, just that dedicated area, and also to provide a resource for on-site outreach. We'll say where we can play videos, because I mean, we do outreach, but we don't have the availability to at like the VFW, because they don't have the communications available to offer where we could connect in with a government computer, so that we could show like a video on VA pension or VA dental insurance. So we're looking to maybe have a better setup to offer these kind of outreach events, where we'll start out in you know, see how it goes. I mean, not that we won't still do outreach within the community, but it gives us another avenue of how we can reach more people and be able to, you know, display what is available to each and every veteran or surviving spouse.
I think it's a great idea.
Yeah.
Yeah.
So,
Luck.
oh,
Good luck.
questions? No, I'm sorry, my hearing's not that great, so I hear like echoes and stuff. And then with so I would like to inform the committee and the board. I've done my research, I've done it twice, reaching out to the VA Medical Center in Stratton. This was at the request of the administrator during our budget meeting, and also the advocate at the VA hospital. Right now, we're transporting 5 days a week, and it's sporadic. We might do 1 person on Monday and 4 people on Friday. Maybe nobody in between, maybe somebody in between. So I started calling the other counties also, asking them what they're doing and how they transport. And every county is different. So it's truly up to the directors what they see fit for their department. So what I would like to do as of the first of the year is streamline the transportation to 3 days a week, Monday, Wednesday, and Friday. The majority of clinics are open at the VA during that period of time. Now, we will always transport if it becomes medically necessary. If it's for drug and rehab counseling or dialysis, cancer treatment, we would run 5 days a week if that presented itself. So it's not that we're taking away from anything from the veterans. I think we're just trying to streamline the process, okay? Which in turn would save money on maintenance, you know, driver salaries, things that, you know, having them come in when they don't need to be here, that kind of stuff. It just will help with that. And also, We transport for the OFA, Senior Veteran Transportation, on Tuesdays and Thursdays. But if that driver's unavailable, this will also help streamline the process of getting somebody to backfill his position. Because he's kind of dedicated or earmarked for that transportation. But things come up, he might be sick or whatever else is going on. So now that I have three other drivers free on Tuesday and Thursday, because we're not going to the VA hospital, I'll have other people to pick from to try and backfill those. So we can stay and keep both of the transportation going with no problem. Okay, I would, so I would like to be putting that out as of January 1st, but I'll start promoting it now. And I just wanted to make you aware that that was what was gonna happen. Again, I don't, if at any point in time something happened, or I'm just making up a story, a clinic only opens on Tuesdays and Thursdays and somebody needs to go, we're still going to transport for that. I didn't want you to think we wouldn't, okay? And then we'll adjust and adapt as you know, the situation arises,
That's good.
okay? Any questions with regards to any accomplishments or goals for the new year? I'm on the next page with department updates. So Supervisor Driscoll had asked me to give an overview of what the actual transportation to and from the VA looks like. So I'm giving you a 3-year count of what those numbers look like. And then he also asked about the flow of the office. So from January up through the 10th of September of this year, we're now tracking every single phone call that comes into our office and all walk-ins or appointments. So we're doing a high volume for 2 people. There's no doubt. Now, Janet is working in with some of the basic preliminary stuff of requesting records from the National Archives, or finding out and verifying awards with the VA. So she does things that she can do and handle at this time. It takes a long time to get educated in how VA works and where to find the information. So I mean, my expectation would be that she'd have a better understanding around June of next year. But for right now, she is handling you know, all phone calls coming in, tracking all the transportation that needs to happen outside of OFA. They do their own tracking of their transportation. But she is handling quite a bit to date, and only being employed for a few months. And then lastly, I'm going to go over the last page. This is the most important, I think, out of anything we do. It would be the claims that we submit on a daily basis, the awards that come in. And I'm gonna have you look at the 2023 current, because that's where we for the first time ever went over the $1 million mark. So as you can see, we picked up another claim. So after Jeff had left, we also picked up one more claim. So it went from 209 to 210. The first column is, what does the amount of money look like that the veteran is receiving prior to us helping them? Okay, prior to us helping them. So those are those numbers. And then the new amount is what the Veterans Award looks like after we help them. Okay, so you can see, I mean, it's got a good amount of money there that the veteran was increased, the veterans were increased, or surviving spouse benefits from the 183,000 to the 307,000. And then so that gives you $124,066.75. That is the difference between what they came in with and what they left with. Now, the retro is totally separate from all the rest of the lines or columns. That is the difference in money that they received in a retro for whatever reason. It might have been an effective date back 10 years ago that we found out that the VA should have awarded a benefit, or it could be, you know, there's numerous reasons why we would have had a retro come in at $1 million, but that is a good chunk of money right there that is non-taxable. So for the most part, we're only assisting with Warren County veterans, maybe Lower Essex, South Glens Falls, because we're closer than, Ballston Spa. But for the most part, these are Warren County veterans, not Hudson Falls, or Washington County, but Warren County veterans. So they're out in our community spending that 1 million, what is it? 1.3 million. They're out in the community, whether paying their back taxes, buying a new car, whatever they might be doing. So the county is seeing some of that coming in from their portion of the sales tax. That's a beautiful thing. Now, Cindy and I hope to continue that, but with 2 VSOs, again, it limits the amount of time you can spend on research for certain things. I mean, we certainly will always do the best we can, but 3 VSOs makes a difference. You know, at this time, we don't have room for 3 VSOs, but maybe in the future, that might be something that you know, myself or the next director might want to look at. And I just wanted to put that out there to you. But going over this sheet, I just updated all the numbers. So from 2019, which I do believe, if you see static, that means nothing's changed. So 19, 20, 21, which they will fall off eventually. 22 still gaining momentum, 23, 24, and 25. You'll see what our numbers look like. Any questions with regards to the claims? I mean, this really is the meat and potatoes of what we do. It is the backbone of making sure that veterans and their surviving spouses have, you know, a home to live in, food, shelter, health. So I'm pretty proud of, you know, what's gone on over the last couple of years. And Cindy and I will continue doing what we do best, and we're enjoying every minute of it. Okay.
Good.
Any questions with regards?
No, this is good.
All righty, well, I think that go
Before
ahead.
you leave, just like to say what a wonderful job you've done. I can remember when we hired you in 2007, was it? How it was just you. You worked tirelessly 7 days a week. And in this amount of time, you've only gained one other person to more than triple the amount of money you brought in. So very nice job, Denise. The veterans are lucky to have someone like you to advocate for them. So I just want to thank you for that.
Thank you. Thank you very much.
Thank you, Denise.
Yes.
Good.
Take care, everybody. Happy fall.
Thank you. She first started,
Uh,
she worked every day.
We take
Yeah.
DSS next.
Can Youth Bureau go first based on the time frame? So, okay, can Youth Bureau go first?
Yeah.
Thank you.
Renee.
So the Youth Bureau.
So we're here today because as part of some state funding that comes in from OCFN, we need approval to submit the resource allocation plan. And that has 3 separate funding streams. It would be the Youth Development Program funding, which is what primarily goes to the towns and the city of Glens Falls for to support the recreational programs and community-based programs. And then there's funding called Youth Team Sport, and then funding called Youth Sports and Opportunity. Youth Sports Education and Opportunity funding. I always switch those. So within the resource allocation plan, the YDP funding for this year is a little bit more. It's an increase of $5,885. The Youth Sports Education and Opportunity funding is up $15,542. And then the Youth Team Sports funding was just a slight raise from last year of $313. So we would need permission to submit the resource allocation plan as presented. And then for DSS to proceed with the contracting for the programs for the program year 10/1/25 to 9/30/26.
Good.
I'll bring it to the floor.
Roger Trainer, second.
Second it.
Roger Runyon. Any questions, comments? Now I'll call a question. All in favor, say aye.
Aye.
Opposed? Thank you.
Thank you, and that's all we have, so.
Have a good day.
Thank you.
Will you be quite as quick?
Thank you.
Try. We'll have Countryside go next,
What's that?
we'll have Countryside go next, if that's okay with everyone.
Morning.
Morning.
I very, most part, it's just reviewing over my 2026 budget and everyone's had a chance to look it over. I'm just gonna do the highlighted, codes that you will see the changes in. So going to 1830, we actually just received, we had said we're gonna have $900,000, but we were waiting for our new public home rate, and that just came last week. It's about a 7% increase at 158.05. Going to 110 personnel requests, I want to continue my MOU with Public Health to receive nursing services. And that's done, it's about $8,000 through payroll distribution. The other personnel request for 110 is to increase our part-time cleaner or laundry person to a full-time position. Last year, I think all of us kind of felt the effects of what, flu and COVID and RSV, and they are really our first line of defense. And it is a hard job to try to do it all in 4 hours, especially if you have a coworker that's sick. It's a little too much. And it really does meet the compliance issues too. 415 electricity, we spent $53,928 in 2024. We're asking to increase it to 65,000. We are at this point, when I looked at it yesterday, we only have $2,000 left. And that is to cover us for October, November, and December, and we're averaging between $6,000 and $7,000 a month for electricity. With the National Grid increase rates,
I'm sorry, how much did you say? Of what was the amount?
that we have left, to a little over $2,000.
And the monthly is generally,
Between $5,000 and $6,000, 7,000 like in December. Yeah.
okay,
A 426 subscriptions. We have to increase that because we have to pay for Microsoft Office now. We have 10 users, so that's gonna equal out to $4,100.
mhm.
What was that? That's quite an increase. What was that for?
I'm sorry, I didn't hear the question.
It's quite an increase. What was it for?
The Microsoft Office, we have to pay for each individual user now.
What's that? I'm sorry.
We have to pay for each individual user for Microsoft Office.
Okay.
Yeah, that's what you do, yeah.
Food. We have 8 meal sites now. I'm pretty proud of that. That's probably one of the most important things, besides taking care of our elderly, our seniors in our community. That is probably the thing that gives me the most pride, is the fact that, we're getting those meals out. Well, with that, we've got to increase our food costs to, I'd like to increase that by another $15,000, taking us to $265,000. Inflation, the additional meal sites, our census is increasing. It just makes sense. And then the only other, and I think everybody's packet had a contract list, is 470s and I'd like to contract with DPW to do paving. It's definitely a compliance and safety issue. Our parking lot is in dire condition. It really needs to be done. And that includes the walkway for the residents to go around the building, and right now it's truly not safe.
Have you talked to Evan?
Yes, they're working on a plan. Hopefully we will get that done part of it done, the rest in next month.
So you're just gonna take this money and reimburse him?
No, this money will finish what they can't complete on their own.
Oh.
Anything else? Any,
That's pretty much it.
any
Anyone have any
questions?
questions?
What number, how many residents do you have at this point?
36, and I have another new admit coming,
You what, take 39, 40?
40.
Okay, thank you.
Thank you very much.
Thanks, Amy.
Okay. Department of Safety Services.
Okay, good morning, everyone. Afternoon, I should say. I'm going to address a few action items that we have on the agenda first. The first request is to rescind Resolution 276 of 2017 regarding the Commissioner of Social Services authorized to execute contracts. We've been working collaboratively with the County Attorney's Office, and we're requesting, based on New York State law, requires the Board of Supervisors to approve contracts. So we're delegating that authority to the Board of Supervisors.
You want to bring this forward? Supervisor Strainer. Supervisor Runyon. Any
Right on top.
questions or comments? Excuse me,
Sorry.
any questions or comments?
Go ahead.
If not, call the question, all in favor, say
Aye.
Aye.
Any opposed, abstained? Thank you. Next, request number 2.
So the second request is to continue our agreement with the Washington County Youth Bureau for 10/1/25 to 12/31/26 for a total amount not to exceed $219,390. This is for the administration of the Youth Bureau, as well as the Differential Response Program, Juvenile Justice Restoration Program, and the PYD Pre-PINS Program. So we work with, the Youth Bureau collaborates with us and the Probation Department for these services.
Supervisor Turner, Supervisor Runyon on the second.
Request number 3, and, oops, sorry.
Got to vote on it.
Any questions, comments?
Just one question. Is this a contract that can automatically renew under the same terms and conditions for an additional year?
The funding and the year would be updated, but yes.
Okay. So I would recommend it, as long as it's not to exceed the amount that the board approves next year, then the department wouldn't have to come back, but if it does exceed the amount, you would have to come back to adjust. If that's agreeable.
Yes,
So you just need to amend the motion on
Right. is that okay with,
Yeah. I'll make the motion to amend.
well, no, it's up to the,
Fine.
right,
Okay, I'm good.
okay. So any questions or comments? Now call the question, all in favor, say aye.
Aye.
Any opposed? Same, thank you. Next is request number 3. Request to continue.
So request number 3 and 4, I'm asking to remove because they were handled at the last Board of Supervisors meeting. We're all set with those agreements.
So we will. Number 3. 4. Okay, number 5.
Request number 5 is to, for the Department of Social Services to continue to work with the Waite House to provide the family-centered case management services. They provide just a component of our plan that the Department of Social Services operates for a term commencing September 1st, 2025 and terminating June 30th, 2026 for an amount not to exceed $50,000. On a side note, the request form should be updated to reflect the $50,000. The $40,000 was inadvertently put on that from the previous one, so this is based on the allocation that was provided by OTDA for family-centered casework services.
Very good. Okay, move forward. Right, Patrick, you guys are running on second. Any questions, comments? Nope. Okay, call the question. All those in favor say aye.
Aye.
Opposed? Any? Yeah, thank you. And last but not least, number 6.
Request number 6 is to appropriate funds from the general fund unappropriated surplus in the amount of $225,880 to increase Medicaid. This is the appropriation will cover the county Medicaid costs for 2025.
Okay. Care to bring this to the floor? Supervisor Strainer, Supervisor Running on the second. Discussion. No discussion. Okay. All in favor, say aye.
Aye.
Opposed, abstain? Nothing. Okay, discussion item.
So we provided the report of updates and activities for August. We'll do the same for September for the purposes of keeping this going. We'll have Jill talk about our current monthly report.
Yes. Year to date, as of August, the expenses were at about 60% of budget, which is good. And revenue, we're about 55%, a little low. It's coming in slowly. This month has been very slow, but I'm hoping to get some increased revenue in the next couple of months here. The one thing I do want to say is that safety net account 6140-470, we're out of money. So we will be back next month asking for money. I just wanted to forewarn you of that. I've had to transfer 300,000 in, another 200,000 today, just to cover the payments. So that was a little bit under budgeted, and I am concerned about the budget for 2026 with that, but I just wanted to give you a heads up. And then overtime, we're looking pretty good. We're right about where we were last year. As far as the budget, though, we're at 79% of our budget. So we're going forward, we're really going to encourage the use of comp time, because that will come out of our 110 salary code and not the overtime code. And we should have some money, extra money in the 110 salary code, because we've had some open position. We could be able to cover that.
Questions, comments? Okay, what else?
Okay, budget. So, if you look at your budget packet, it's a bit overwhelming, but the first 3 pages are the 2026 revenue and expenditure projections. So it's really for a tool for you to compare our projected expenses, programs, and requests. I'll go through and highlight some of the specific things that for each category to help explain. So for our 60110 administration, we are looking to reorganize a couple of positions, so making a shift based on titles to meet the administrative requirements based on recent legislative changes that impact employment requirements, changes in Medicaid. So we have the positions that we've either been able to shift or request to delete and change titles to meet those needs. And that's really just to handle caseloads and quality assurance on those cases. The other thing we're looking to do is a caseworker training unit initiative. It takes quite a bit of time for a caseworker to get trained. So we're hoping that we can train them, onboard them, and when we have vacancies, backfill that position with someone who's trained. We have some great ideas about that, and we think it'll be helpful in terms of supporting the retention efforts as part of our constructing progressive solutions. Also to note, we're still waiting on a few administrative directives from the state to give us our program allocations. So you'll see some areas that we're really doing our best to estimate costs for that. In addition, we're looking to add an intake clerk based on the increase of calls. And just to give you an example of a snapshot, for July of 2025, one person received 946 calls. So they had 491 voicemail messages that they had to check. So when you're thinking about the intake of the Department of Social Services, we have to make sure that we're able to answer calls and meet the needs of consumers, and adding an intake clerk is extremely important in doing that. The next, any questions in that area before I keep going?
Anyone?
Go.
Okay, so the next area would be 6050, would be detention. We're waiting on the allocation to see for programmatic planning, but I'm going to talk a little bit about alternatives to detention and some initiatives that we're looking at. 6055 is daycare. We put in a request for an additional funding. We're still maintaining a wait list, and with the changes that have been made, unfortunately, we're not able to provide services to as many families that we were able to previously. So in 2024, we had 211 families. March of 2025, 230 families. And as of September, this month, we have 164 families. And we're continuing to deny cases, maintain a wait list just based on the current allocations that we have. So we've put in the request based on how much we think we would need. And you have that comparison to the budget if you look at the cover sheets. 6070 470 services for recipients. We're looking to contract with the Youth Advocacy Program. This is based on some reimbursement through the Family First Prevention Services Act, which was the federal bipartisan budget of 2018, enacted 2918, and the New York State approved 5-year Title 40 prevention plan. YAP is an evidence-based program for the purpose of the prevention of removal of children by providing mental health, substance abuse, and in-home parenting skill programs and services. This is up to 100% federally funded. So this is a program that DSS and probation can work with to serve our highest risk youth in our community, which also have a significant cost in terms of placements. 6100 Medicaid. This is the projected budget based on the weekly statutory share that was provided in 2023. We included an estimated 5% increase, which is based on prior years. DOH, Department of Health, is expected to send the new amount in January of 2026. So that's an estimate. 6109, 6070, your TANF and safety net programs. We included estimates, which we continue to express concerns about, for motel rates and increase in temporary housing, the cost for housing, but also the length of stay in housing. There's a work pays initiative, increasing the earned income disregards, and then additional birth allowances for public assistance recipients. Now the baby benefit to provide for the immediate needs for the birth of a child to improve the health of newborn infants. 6119, 6109 are state aid rates for foster care programs and CSE placements. I do want to highlight that we've been the first in New York State to implement a supervised setting program. It's a project with the Waite House, which serves youth in care 18 to 21 and is a 4E funded program. It really helps in their successful transition into an adulthood. There's been an increase in kinship placements, which is a decrease in 4E funding. However, it's encouraging to keep children with their families. The HEAP program, we haven't received our administrative directive with the allocation. We do anticipate program cuts, which is also reflected in the TANF and safety net program for energy emergency assistance, because with cutting in HEAP programs, there's the potential risk of having emergencies on the temporary assistance side. Youth Bureau, we discussed that. For 2026, we have a few goals, but overarching, it's really making sure that we're maximizing reimbursements and aligning payments with correct general ledger expense and revenue codes. I'm really confident based on the budget that Jill and I put together. Jill did a really nice job in understanding what the programs are, what the reimbursements are, and how we use funding, understanding the numbers that we're putting in the budget. And agency onboarding and training, we're continuing our constructing progressive solutions. Reduction in case error rates, continued quality assurance. Really focusing on shortening the length of stays in temporary housing and maximizing shelter supplement programs for permanent housing, and using data to develop plans that align with the purpose and relevance of workforce, community, and programmatic changes and needs.
Very good.
That's a really big highlight. So if anybody has questions.
Any questions?
First question is about the transfer of 200,000. That comes out of fund balance? Back in the 200,000 into.
Oh, the safety net?
Safety net, yeah.
I borrowed it from 6119, another code.
Okay, so that's internal.
Yes.
Okay, and then the number of phone calls? That seems I mean, we don't have enough people to answer the phones or.
It's the amount of phone calls that are coming in. So
Right.
we have people there. It's just, it's hard to manage the volume of those calls. So
Because
we're shifting, we're deleting positions in other areas to meet the need by adding that intake part in that.
I would say that's important because
Right.
when somebody calls, I mean,
Right.
I called, and I have to go through that phone tree. I'm not a fan of that, but and then safety net, is that the last? That's cleans up all the other money that you don't get from one of the other programs, the safety net or what?
So the safety net population are adults, so not a family. And then if families end up on assistance and meet their 60-month time limit, it does shift to a safety net budget.
I just, we know what's potentially could happen down the line and answering the phone when people, I took a call from a constituent that I had to reach out to you folks to answer, it's tough. They don't understand. And then, I don't understand the programs well enough to be able to tell them. And I guess childcare is being cut too, or some of those programs.
So it's right now, it's a program that
You have a waiting list.
we have a waiting list. We don't have the allocation to support the need in the community. So that's why we're requesting.
I know things coming down the line, it's gonna get tougher.
It is.
Okay, all right, thank you.
Anyone else? Have no referral or pending item. Privilege of the floor. Comment.
No. Thank you, Mr. Chairman. Just a quick question, a follow-up to by Supervisor Gary's question. He asked about money being moved.
Mr. Diamond, go to the
Okay.
microphone,
Thank you.
please. Thank you. Thank you.
Chairman asked about monies being moved from one line item to another. I think the number was 200,000. Is that correct?
Yeah.
And it was mentioned that you're borrowing the money.
Well, I'm moving it from another,
So are you saying that you don't need a 200,000 in that line item that you're moving it from? So how are you gonna make up the 200,000 if you're gonna transfer from one line item to another? The line item that you're moving to 200,000, how are you gonna reimburse that for that 200,000? From fund balance. So the question the chairman asked was, are you moving it from fund balance? You said, no, you're transferring it. You're transferring it from one line item to another or borrowing.
Yes.
But you're gonna come back to committee in another month and ask for that 200,000 to come out of the fund balance. That's my question. Okay,
Misunderstood.
all right, thanks.
Anyone else? All right. We'll entertain a motion to adjourn. Favor?